Mike Gibson and Evan Zahn coming to you live from SCAI 2017. We're talking about VSD in kids. You know, when VSD happens in an adult, to me in the middle of the night, it's a horrible, catastrophic complication. Sure. I'm learning here at this meeting that kids aren't just little adults. You know, there's a lot of differences in terms of radiation exposure, in terms of drug exposure with a drug-eluting stent. You know, a child can get systemic, levels of these immunosuppressants with some of our adult stents. And then finally, we have big markets for adult devices, but you have much smaller markets when it comes to kids. And then the regulatory path sounds very, very complex. So walk us through where you're at with pediatric VSD, the challenges that you're facing, a little bit of the regulatory approval process and where you see things.
Sure, pleasure, and thanks for having me. VSDs, first and foremost, are one of the most common congenital heart disease we see, among the top 5 for sure. Typically, at least in the US, what we're seeing mostly are perimembranous VSDs. We do see muscular VSDs, but by far perimembranous VSDs are more common. As we sit here today, although there have been devices and device development for perimembranous VSD for decades, we currently don't have an FDA-approved perimembranous VSD occluder. We have a muscular occluder, of course, which is very useful in muscular VSDs. Great device. We can occasionally adapt that to the perimembranous VSD and, of course, the post-infarct VSD.
Sure.
But what we really need to work towards is a perimembranous device that will be approved in the U.S. for pediatric and adult market. There are some very good products around the world that are fairly time-tested. I just came back from China where they do scores of these every day.
Yes, and it's amazing to go there. I mean, it's just like a factory.
The volume
is amazing, isn't it?
Yeah, they'll do 8, 9 of these in a day in Shanghai. But we really need to get that going here. As you noted, the approval process in the U.S. can be somewhat arduous for all of us, but encouragingly, we've found as of late that the FDA has really sort of reached out to become a pediatric device partner. We're involved with 2 trials, one involving a premature PDA device that we're just about to start, as well as some new transcatheter pulmonic valve therapy. And we have found that the quote-unquote new FDA, and it feels that way, really is working with us as a partner and helping us with the approval process. And I think that looks very good. This would be very good timing, shall we say, to start working on the approval process for a membranous VSD device. I think the other piece of that, of course, is, as you noted, we're a niche market. The pediatric volume will never be what the adult volume is, but obviously it's an important market. The way I think of it is in patient years. You guys do wonderful things, but maybe that patient's 80. And we do wonderful things, but on a much smaller population, but they have 100 patient years each one. So I think it's really important to get industry re-involved and really help us to get something out there for, I think, what we would all agree are our most valuable patients, children.
And what are some of the key take-home messages for adult cardiologists like me regarding the management of the adult patient with a VSD?
Yeah, I think I look at it this way.
Congenital VSD.
Yeah, I look at it this way. For the overwhelming majority of my career, I was isolated, so shall we say, in a children's hospital. I lived in that world. Now I work at Cedars-Sinai, a big adult medical center with great adult colleagues, adult cardiologists. And I will tell you, when I'm doing a tetralogy or a Fontan, and I have any question about acquired heart disease, be it coronary artery disease or hypertension, I can muddle my way through, or I can talk to one of my colleagues who's a world expert.
Sure.
I think as an adult cardiologist, it's obvious that adult cardiologists can take care of VSD. It's a fairly simple lesion. But I would encourage people to reach across the aisle, if you will, and talk to their congenital and pediatric colleagues, because there are subtleties. Our literature changes just like yours does.
Sure. And
things come up, and new things like devices become available that you might just not be facile or aware of, because it's not your world on a daily basis. So I think the key is collaboration, actually, and reaching out.
Great. Well, Evan, thank you for joining us today, and I want to thank all of you for joining us here live from SCAI 2017.